Hey, it's Dr. Bill Williams again, and we're asking the question of how do I use ASEA and Renew 28 in my practice? And of course, a lot of dentists want to know why are you involved in ASEA and Redox biochemistry in the first place. So my number one reason is for personal use, and I recognize that beyond the personal use, there's the place for it clinically in our practice because everybody has cells and everybody needs to be healthier. Everybody wants to be healed. And so I've looked at the area of our expertise dentistry and I've said, how can dentists use this to become better clinicians, better practitioners by applying this to the work we do every day? And because we're surgeons, because we're working in the oral environment, there's a tremendous area of improvement for our patients available if we'll just put it to use. And so let me talk a little bit to you about what I do in my practice to help our patients. The foremost way we use the ASEA Redox is as an antibacterial oral rinse for 1 or 2 minutes. And so we tell them to swish it, and as opposed to spitting it out, we tell them to swallow it to gain the potential systemic effects of improving their blood chemistry, the things that happen to your body once you swallow it and it gets ingested are tremendous. They're marvelous because it's an excellent supplement for causing a reduction of inflammation, for supporting the immune system and the digestive system, the circulatory system. So you achieve all these results when you swallow the liquid. And so it's the only antibacterial rinse that you can actually get a systemic effect beneficially. If you swallow some of those things that are made for antibacterial mouthwashes, they're harmful. They hurt you. They poison. And we don't want that in our body. And so we're looking at the ingredients of many of these products and say, it kills the bacteria, but it can harm the body. Not Redox, not the ASEA product called ASEA Redox. You can swallow that one, and it's meant for improving the body's health. So it's a major benefit, and I highly promote it for that one reason. I like to have my surgical patients on the ASEA Redox for 2 to 4 weeks before surgery, so they build up their natural body immunity and systems and ability to fight inflammation, actually to grow bone better, to heal faster, and have less pain. So when you have adequate redox signaling molecules within the body, and we know that they're depleted with age, and you can add them back as a supplement with this process, then we know that they're going to heal faster and heal better. And so we want pre-op treatment, and then we want to follow up with another 2 to 4 weeks of redox supplementation after surgery to continue the healing, because we know it takes typically 6 to 8 weeks to heal an area after surgery. And what we find is with the ASEA Redox is it's a much speedier recovery, much less pain for our patients to go through. So I've seen it firsthand with patients I've treated, taking out wisdom teeth, doing periodontal surgery, putting in implants, watching the healing. It's so much faster, so much less pain when patients are on the Redox. It's worth the effort, the money, the time to talk about it with your patients, because they'll be so much better in their comfort level and their healing time, that they have less downtime, they have less discomfort at home, they won't call you and have to get pain medicines so much better situation that I can't imagine not using that in our practice. For our periodontal patients now, we'll go in and we'll use this as a irrigate. We'll use it as a subgingival irrigation when we're treating our laser periodontal patients. It's good for any surgical wound area, anything you want to heal. If you want to have bleeding stop, you just put the ASEA on the area and it stops the bleeding pretty rapidly, because there's something about the molecules that shuts down the bleeding quite quickly. So we're really pleased with that aspect of it. If you've got an area that's bleeding, you can bring it to a halt much quicker by having the Redox. Now there's Renew 28, which is a gel, and it's not listed as something that's oral, and you don't ingest it on purpose. But we found it off-label. We can use that in areas on the gums to improve healing. We found that it will prevent dry sockets. We found that it will stimulate the healing because the concentration that's in Renew 28 is a higher concentration than is in the ASEA Redox liquid, which is meant for ingestion. And so we're telling our patients that if they rub it on the gums, they'll heal faster. If we put it on the dry socket or on the fresh socket, you'll prevent a dry socket. And we found that's very helpful, and we've been very pleased with that to date. You can also use it on oral, facial, skin, mucous membranes for gingival lesions caused by bacteria, viruses, or fungus. And if you got autoimmune disorders that are having oral expressions of diseases, you can rub it on those oral lesions, and they'll feel better and they'll heal faster. And so we're looking at cuts and burns healing faster, and things that are in the mouth or on the skin, outside the body. They're all improved when you coat the ASEA Redox liquid and Renew 28 on them. If I'm treating patients holistically, I'm looking at their TMJ, their jaw, their neck, head and neck pain. And for the last 35 years, I've been an international lecturer on head and neck pain related to TMJ and temporomandibular joint disorders. And so I found that there's a use in that area for the ASEA Redox and Renew gel. So you can rub the gel on the area of pain 3 times in 5 minutes, and mostly the pain goes away. If you've got patients that are in pain, got headaches, and you rub this gel across the neck muscles, across the face, then a lot of the pains are going to go away, and it's a major benefit to them. Same thing with any joint in the body. The pain gets better when you rub it on those areas. So there's something going on in the body that we're really glad to see in terms of pain control. People on liquid ASEA Redox tend to be much less painful. The joints are less painful, the muscles are less painful. And we know that these are supplements that aren't classified, or they're not designated to treat or cure any disease, because no supplements are. But we do know that they do improve people's ability to feel better. They reduce the body's inflammation levels, and you're naturally going to feel better. And so through the natural augmentation of the body's defense mechanisms with ASEA Redox, we're able to see some major changes in head and neck pain and the whole body's systemic pain. They call Redox the DNA whisperer molecule, and it acts to improve our genetic pathways, the genetic pathways that create many of the problems when they're under functioning. Well, the ASEA Redox creates a normal function for many people, and they're able to use Redox for improving their hormone production, their protein synthesis, the DNA transcription to get protein synthesis to happen more fully and functionally, so that there's a better circulatory system, better digestive system. These things make a difference to all my patients. And if I've got chronic pain patients and I'm trying to treat their head and neck pain as a TMJ dentist, I'm using ASEA Redox as one of my fundamental aspects. I get them on it, I keep them on it, and I'm asking them to report to me what improves, what is better with the Redox than before. And I'm always amazed at how many of the symptoms and the signs of TMJ disorders disappear once people are taking the Redox supplementation. So it's Dr. Bill Williams talking about how a dentist can benefit and their patients can benefit from adding ASEA Redox and Renew 28 gel into their practice on a routine basis. Call me if you have any questions. I'll be glad to discuss it with you about how I use it and what's new with ASEA Redox.